I do a range of procedures. Many of the procedures that we do are diagnostic procedures, so these are coronary angiographic studies, and the purpose of these studies is to see if patients have narrowings in the arteries to the heart, and then to assess the valves or perhaps the ventricular function in detail. So part of the procedures are diagnostic procedures to find out what's wrong with the patient. In addition to that, I perform some what we call interventional procedures. So these are types of operations performed through catheters. The most common one I do is coronary angioplasty and stent procedures. So these are for patients who have narrowings or furring up in the arteries to the heart. And this can be a planned procedure for some patients who have chest pain, and it can also be done as an emergency procedure for patients presenting with heart attacks. And we run a large service in Essex for our heart attack centre. So in addition to coronary work, I also do some other what we call structural heart procedures. So there are some patients who have holes in the heart called PFOs, and these are sometimes the cause of strokes in young patients. And there's a procedure where these holes can be closed through a catheter, through an incision that's only 2 millimeters in diameter. And also there's another procedure called left atrial appendage occlusion, and this is for patients who are at risk of stroke related to atrial fibrillation who may have a problem taking warfarin, and it's a one-off procedure, which means they don't need to take warfarin for the rest of their life.